welcome to the DEA Chicago podcast. I'm Luis Agostini, and today we're talking about prescription drug safety and specifically the DEA's National Prescription Drug Take Back Day, which is taking place on Saturday, April 26th across the country, as well as many locations throughout the Chicago Field Division. And I'm very pleased to have joining me today is our one of our diversion investigators who really spearheads our take back initiatives, Erin Johnson. Erin, thank you for joining us.
Thanks for having me.
And also Dr. Sterling Elliott, a clinical pharmacist lead from Northwestern Medicine. Dr. Elliott, thank you as well.
Oh, it's a pleasure to be here with you.
Awesome, thank you both. So we'll get right into it. Erin, let's start with the basics. So just for those who are not familiar with the concept, I know we've hosted it for many, many years, but National Prescription Drug Take Back Day, just give us spend some time giving us an idea of what Take Back Day entails.
Yeah, absolutely. So the DEA will host the 28th National Prescription Drug Take Back Day, Saturday, April 26th from 10 a.m. to 2 p.m. And basically this event offers free and anonymous disposal of unneeded medications at close to about 5,000 local drop-off locations nationwide.
That's great. And Dr. Elliott, from your perspective, from a clinical setting, somebody whose profession it touches every aspect of pharmaceutical prescription medication. Why is this important? Why speak about the importance of safe disposal of medications that you can find in your medicine cabinet or in your household.
Sure. I think it's got a lot of implications. I think a lot of times patients don't know what to do with it. They've got some medication, they've completed using it, they may still have some left over, and they're wondering what to do with it. I think over the years, we've come to learn that putting them into the public disposal arena has some dangers, right? I mean, if you throw them in the garbage, there's always the risk of diversion, and Erin knows that well. People who are looking to get their hands on things of value know to look in the garbage. And so in particular, we're thinking about some of those drugs that are known to cause problems for people, things like opioids, things like the benzodiazepines, and also things like the muscle relaxants. I mean, those are three classes of drugs that for people that are having substance use problems, those are drugs that they're desiring. Oftentimes they mix them to kind of build up the intensity of the high. So that's a reason why we want to get them out. I think there's also an environmental safety component to it as well, and that's sort of one of the reasons that this began as well. We in the past, a lot of the guidance was maybe to get things down a toilet, and that got into the water supply. And even in the garbage, if it was buried in landfill supply, you started to have drugs sort of, for lack of a better term, poisoning the water supply and poisoning the soil. And so I think for these reasons, it's an important opportunity for people.
Great. Erin, our mission, enforcing the Controlled Substances Act, big part of that is obviously, combating the drug overdose and poisoning epidemic that we're dealing with. We're seeing staggering numbers year after year of, fentanyl overdose deaths and poisonings, along with others. But in regards to Take Back Day, the connection, can you walk us through the scale of the problem? Because from what I understand, there are studies out there that say, a majority of people who misused a prescription medication obtained the medicine from a family member or friend.
Correct. Yeah. So pharmaceutical drugs, they can be just as dangerous as street drugs when taken without a prescription or doctor supervision. The majority of opioid addictions start with prescription pills found in medicine cabinets at home. So that is why the Take Back initiative is so big in being able to dispose of these medications and get them out of the home and off the streets potentially.
And Dr. Elliott, I know Northwestern Medicine had great collaborator with the DEA and Take Back Day initiatives. Can you talk about Northwestern Medicine's participation this year?
Oh, sure, absolutely. We've really valued being able to collaborate with DEA on this project. It's a great way to support that mission that DEA has and to underscore the importance of getting rid of those unused medications. And so I think it's had a tremendous effect. And for us, we want to be a beacon in the community that supports that kind of effort. We've been able to do that. It's a chance to educate the public when they come to our sites and drop off their medications. And we've grown the number of sites that we have. We're going to put 10 sites online this coming April. So that's terrific. We had 10 the last time. And, we continue to look for more locations to do this so that we can expand this out. We're also handing out naloxone nasal spray. Narcan is the brand name, and that's the name people know. And we're teaching people why it's important and how to use it. And I think that's critical.
And regarding what people can, bring to safely dispose, can you run just through give an example examples of some of those items that are accepted that can be accepted at a Take Back Day site? Dr. Elliott.
Sure. I mean, yeah, absolutely. We're happy to take back medications that people have in the house. So that can be pills, capsules, a lot of, and that can be prescription medications, that can be over-the-counter medications. They can be in date, they can be expired. We'll take back liquids, and if we take those back, we ask that those liquids are sealed tightly so that they don't spill in the collection boxes. We're not taking back items with needles, so that's one of the limitations. But certainly, I think we're all hoping to get as much of the controlled substances as we can, but we don't ever want to turn somebody away from being able to give us some of their other heart medications and blood pressure medications, things like that. We're happy to take those as well.
Now, there's so many locations, and we have so many partner law enforcement agencies and other healthcare providers that are hosting these sites. There's so many. Erin, where can folks go to find a drop-off location near them?
So they can use the partner toolbox. It's available at www.deatakeback.com, and they're able to put in their zip code that's local to them and put in the mileage, 5, 10, 15 miles, to find their nearest location that partners with us.
And I know in the past I've run a search from our location in downtown Chicago, and within a 50-mile radius, and it's probably has grown since then, but they're close to 100 drop-off locations just within a 50-mile radius of Chicago. So really, pretty much close to anywhere you reside or will be on Saturday morning. There will be a take-back location really close to where you are.
Yeah, that's correct. Yeah, we're working really hard with our local law enforcement and our partners, such as Dr. Sterling and Sterling Elliott, and just making sure that we have as many locations available to the public as possible.
And I will point out, too, beyond Take Back Day, just beyond the one designated Take Back Day, there's opportunities year-round. Nationwide, there are 17,000 pharmacies, hospitals, businesses that have these safe disposal boxes. And even some police stations will have them inside their lobbies. So year-round, there's opportunities to participate if you can make it out this Saturday. To close, Dr. Elliott, I'll ask you both the same question, but what would you say to somebody who is not sure if they should participate or if they're allowed, or just have, for some reason, still, after listening to what we say, they still have some hesitation or reservation about participating? Dr. Elliott?
I would tell people that, this is an important public health effort here. In addition to the environmental aspects and things like that, it's an important public health issue, because the issue of substance abuse and drug addiction is really a substantial public health issue. And, we talked earlier, and Erin brought up the idea that a lot of drug addiction starts with items that are found in the home. But what we find is that it doesn't stay that way, right? It progresses. And as all of us in this discussion today know, the number one killer of people when it comes to opioid-based addiction and substance use disorder is fentanyl, right? Fentanyl is the leading killer of adults aged 18 to 45. And all of those deaths are preventable. But those deaths come about very often because as people find it harder to obtain some of those prescription agents that they had been able to get a hold of, they start making their way out into the street supply. And it's the street supply right now that's just so dangerous. And, I think the last statistic I saw from your organization is that 5 of every 10 doses that are seized contain 2 milligrams of fentanyl or more. And that's what we all believe is enough to be deadly. And, those are deaths that people never really see coming. So you have a really substantial opportunity to impact America's public health in a great way. And I would always encourage someone to take advantage of that.
Thank you so much, Dr. Elliott. And Erin, same question for you. What would you say to someone who's never participated before?
I would just encourage them to make sure that they are coming out. It's a free program. It's anonymous, so it's not like we're going through and inventorying these items that are being disposed of. It's something that's great for the communities to keep them safe and healthy, while also, like Dr. Elliott said, maintaining the earth as well, because we're not supposed to be pouring these or throwing them in the garbage or pouring them down the toilet, So it's a great event. We like to get out there. We like to show the community that we're out there with them and that we're there to help keep them safe. So I'd encourage everyone to come out and make sure that they're getting rid of things that are unwanted and unneeded anymore.
Erin and Dr. Elliott, thank you both so much for joining us, for the incredible work that you both do. To those listening, just remember Saturday, April 26th, from here in Chicago, in the Chicago Field Division, from 10 a.m. to 2 p.m. Central Standard Time. You can go to deatakeback.com for more info. You can punch in your zip code or location to find the nearest drop location near you. Again, I'm Luis Sagastini for the DEA Chicago podcast. Thank you for joining.